My fellow Virgin Islanders, residents, and friends of the Virgin Islands. As I have previously reported, on January 30th, 2020, the World Health Organization declared the outbreak of the 2019 novel coronavirus a global public health emergency. Due to its rapid spread, COVID-19 was declared a pandemic on March 11th, 2020. No region of the world has been spared, and countries large and small continue to grapple with the health, social, and economic disruption caused by this deadly virus. As a territory, region, and global community, we have been united by this glaring reminder of our common humanity and moved with compassion and solidarity to observe far-reaching precautionary measures to protect ourselves, our families, our friends, and our neighbors from this unseen enemy. The World Health Organization now records 3,407,747 confirmed cases, which has resulted in 238,198 deaths. On a brighter note, an estimated 1,161,677 persons have been reported as recovered from this virus. Meanwhile, closer to home, in the Caribbean, a total of 13,693 cases have been confirmed as positive and has resulted in 634 deaths. Again, on the brighter side, 3,886 cases have been reported as recovered from COVID-19. Special attention continues to be given to the high level of confirmed cases that remain active throughout the region. I have stated before, and I will state again, no island nation can be safe until each of our territories are deemed COVID-free. I will again say that we have a duty to look out for each one of us. Over the course of the past week, as per the protocol established, 21 samples from the British Virgin Islands were sent to the Caribbean Public Health Agency in Trinidad for testing and confirmation. I am reporting that while 20 of the samples were tested as negative, there exists one of the samples that was confirmed as positive for the virus that caused COVID-19. These findings were consistent with local lab results, bringing the total number of COVID-19 cases recorded in the territory to 7, with 3 confirmed recoveries, 3 active cases, and 1 loss of life to the disease. Case number 7 is linked to a previously detected case, was quarantined, and had tested negative on the first protocol of testing. It is common that in the early stages of the infection, the virus that causes COVID-19 could go undetected. In this regard, the person was kept under quarantine for the full duration of the incubation period and was retested in accordance with established protocols. This patient has exhibited only mild symptoms and will be kept in isolation. So in summary, we now have a total of 132 persons that were tested, with 125 deemed negative, 7 deemed positive, 3 cases have been actually recovered, 3 active cases, and there remains 13 persons currently in quarantine. We extend our collective compassion and prayers for a full and rapid recovery of all active cases. It is safe to say that the Ministry of Health case findings, contact tracing, monitoring, and quarantine efforts are achieving the intended result of reducing your risk of exposure to active cases of COVID-19. These efforts have been aided tremendously by your compliance with the curfew, social distancing, hygiene and sanitization measures implemented over the past weeks. By doing our part, each of us continue to assist in interrupting the transmission of this virus. As the phased internal reopening of the territory continues to be rolled out, and as we prepare to reopen our borders, it is more important now than ever for all of us to continue to do our part to keep the risk of transmission of this virus to a minimum. The health and well-being of the people of the Virgin Islands remains our number one priority. We will continue our efforts and strive to mitigate the negative social and economic impacts of this pandemic. This novel coronavirus can only be countered with a novel social and economic program that will be articulated by our Premier. It cannot be said often enough that our personal safety, as well as the protection of your family, co-workers, customers, frontline workers, neighbors, and friends of all ages, heavily depend on the actions you take every day to adhere to the various public health guidelines. Remember to sneeze or cough into disposable tissues. Continue to ensure physical distancing whenever and wherever possible. Washing of your hands, sanitizing surfaces, and wearing a face mask, especially in cramped and indoor spaces where physical distance may be compromised. All work in combination to safeguard us from this viral respiratory disease such as COVID-19. Person exhibiting any symptoms, fever, cough, headaches, fatigue, loss of taste or smell, sore throats, muscle aches, or difficulty breathing are reminded and encouraged to call the health line at 852-7650. We must all remember that working together to prevent, detect, and contain the spread of this coronavirus is our very best chance of stamping it out. As a government, no expenses have been spared in preparing the facilities and in purchasing the equipment and the personal protective equipment required to fight COVID-19. The truth remains, however, that we will only have all the equipment and facilities required in the fight against COVID-19 if we need none of the COVID-19 equipment and facilities that we have. I continue to believe in all of us to keep each other safe and healthy as we live and work in this new regular of COVID-19. Once again, I thank you, and may God continue to bless our people and our beloved British Virgin Islands.